So we have really two categories of medications. Those that target at the level of the tumor itself in order to reduce growth hormone secretion and in some cases shrink the tumor remnant that is present. We also have therapies that are more targeted at decreasing the insulin-like growth factor or IGF-1 production from the liver in response to that growth hormone secretion from the tumor. So really at two different levels. And these can be used as single or monotherapies. And in some cases, it is necessary to use combinations of these medications to control growth hormone IGF-1 levels and tumor growth. At the level of the tumor, we think about somatostatin receptor ligands. These are medications that bind to a receptor on the surface of the tumor. They turn down growth hormone production. They can slow tumor growth and sometimes even lead to cell death. And so these are very important medications for use for patients with acromegaly. They include some of the older injectables, sandostatin LAR and lanreotide autogel are both intermittent intramuscular or deep subcutaneous injections respectively, that patients will have an injection every 4 weeks and in some cases every 6 to 8 weeks, depending on the control of their disease. A newer medication in the landscape in the last decade is pasireotide LAR. It is a similar somatostatin receptor ligand, although it has more activity in many of these tumors and can be used for more aggressive or large tumors that are not as responsive to octreotide or lanreotide. And then we now have the new kid on the block, which is oral octreotide capsules. So we understand how octreotide works to treat growth hormone tumors. And so now there is an oral formulation. So instead of a monthly injection or every 6 weeks or every 8 weeks, patients now have a choice to do the oral octreotide capsules, which would be twice daily. And so it just really depends on the patient's preference, their own personal characteristics in terms of the tumor, as to whether which of those therapies would be appropriate for them. With regard to a therapy that targets at the level of the liver, we have pegvisomant, which inhibits the production of insulin-like growth factor from the liver in response to growth hormone. So it's not really going to control the tumor growth per se or shrink the tumor, but it does lead to lower IGF-1 and can really alleviate symptoms in many patients because of that hormone.